and unintended pregnancy and access to education. I'm honored to welcome today our esteemed panelists. The first one is Messi Chege, who's the Director of Programs, Quality and Strategy with Plan International. We are also joined by Jane Gaongalelwe, the Principal Education Officer, Curriculum Development and Evaluation Department of the Ministry of Education in Botswana. We have Mr. Elias Kantempa, who is a nurse and midwife and SRHR advocate at the International Youth Alliance for Family Planning. Last but not least, we have Dr. Kakea Ntaia, founder and president of Kakenya's Dream. So before starting the conversation this afternoon, I would like to give you a quick overview of the session and provide you with key information about the Zoom platform that we are connecting on this afternoon. So we're going to structure this session as a discussion with the panelists and young people using some audio testimonials or short stories from young people as conversation starters. We will have a question and answer session for participants, and this will be conducted so you will be able to use the chat function on either the Zoom platform or our Young People Today YouTube live stream for your questions, which is streaming simultaneously with the webinar. So you can add your questions to the Zoom platform or the Young People Today YouTube live stream. We invite you to use our hashtags, hashtag Say It Louder and Let's Talk EUP throughout the session. I'll also be informing you that this session will be recorded. At this point, I'm going to ask for the jingle from Say It Loud.
Say it loud.
My corona. They take off our clothes.
Of course.
Thank you to the technical team. The volume was a little bit low. I don't know if it was on my machine or if the other participants were able to hear. Maybe we can correct it the second time we play another jingle. So welcome again to our panelists. So we're going to start our conversation now, and I'm just going to ask our panelists, maybe we can start with Kakenya. How would you describe the overall impact that COVID-19 has had on the well-being of adolescent girls and young women in the region, but also particularly in Kenya, which is the country where you're from?
Thank you so much, Patricia. I think I would like to start that by sharing just a story of a girl who I would call her Faith, who goes to my school in rural Kenya. So Faith, before COVID, the only place that she knew that was her home was our boarding school. She had supportive teachers. She was studying chemistry. She was in a thriving environment. She was focused on her future. And then COVID's arrived in March. All the schools in Kenya were closed, including our own school. That means Faith had to go back home, where she is a first girl or in a family. She's the first of a family of 6. She no longer has a space that she calls her own. She shares the bed with her siblings. She doesn't get 3 meals a day because there's no food. She is supposed to take care of the siblings, go out and collect firewood, go collect water. Everything that her life was now is not focused about her. It's about fetching and taking care of the others. With that, there's so much pressure in the family. So she has no social net, which she had in the schools. She's isolated. And on top of that, she has no access to personal effects. And so what is happening in that situation, thank God, because of our schools that we have, that we continue to support those things. But she's lucky because we were there. But for other girls who don't have a place that people who can support them, provide food, provide personal effects like sanitary pads, just being there to call her and listen to the girls. The girls are isolated. They're finding rescues in sugar daddies, and they need stuff to feed their family. Life is difficult for these young girls. We're seeing them getting pregnant, and they don't have a space or a place that they call. So COVID has really impacted the life of girls, in not just in Kenya. I know that in every rural community throughout Africa. We need to step up to see that we can provide for those girls in their homes. Thank you.
Thank you very much, Kakenya, really talking to us about how COVID-19 has exposed adolescent girls and young women to vulnerabilities that they would have not encountered had they been in a protective environment of the school. I think we've seen research talking about, the protective aspect of being in a school, be it a day school, be it a boarding school, but those hours that young people spend in a school are protect them from the exposure that they would otherwise have faced. And I think COVID-19 has really outlined that fact for us in a number of countries. I'm going to move now from Kenya to go to Botswana, to Jane, to talk about, what have you experienced, and also in your position as a senior official in the Ministry of Education in Botswana. I will ask Elias to get ready to respond after Jane. Jane, over to you. Please remember to unmute.
Oh,
great, thank you.
Yeah, thank you, everyone.
Thank you.
Yes, as in the case of COVID-19, its impact on our girl child, COVID-19 has really affected most of our girl children, adolescent girls, because the school acts as a safety net for them, and as they were trapped for quite some times in their homes, our kids were really exposed to a number of, quite a number of GBVs were reported. And according to what we hear from the police and NGOs working with the schools and community and government reports from government clinics, it is quite clear that, our kids were so vulnerable to a number of issues. Majority of these girls, because as in our case, we had a toll-free number where we really wanted kids at home to call and share their experiences, what they were going through as they were home, anxious to go back to school since they were not safe wherever they were. I mean, some girls would call just to ask questions as to when schools will open, and they were coming up with quite a number of reasons as to why they need to go to school. Some were sharing with us that they were being exposed to abuse, such as sexual abuse, and some of them really were trapped in and they couldn't do anything to themselves. And as Minister of Education...
Go ahead, you can finish your sentence, Jane. Please go ahead.
Oh, no, it's okay. I'll just continue later.
Oh, okay. Yes, thank you, Jane, highlighting for us the issue of gender-based violence being faced by young people, and also the challenges, young people face, particularly those who are in the rural areas. I think we felt, particularly for those in the exam classes, in some countries who had to continue preparing for their exams while they're in a home environment where they're still expected to do all the daily chores that they had to do. Meanwhile, they're struggling with keeping on top of their schooling with no formal instruction taking place. I'll now ask us to go to Malawi to hear from Elias what the experience has been for young people in Malawi.
All right, so just to concur with what my friends have just said, indeed, COVID-19 has had a profound impact on the lives of adolescent young girls and women. For example, according to a rapid assessment report from the Ministry of Gender in Malawi, Malawi has seen 40,000 teenage pregnancies. At the same time, Malawi has also recorded 13,000 teenage pregnancies within the period when COVID-19 was at its peak, and it is the very same period when the government of Malawi closed the schools. At the same time, access to education has also been poor because schools have been closed, so students or these young people have not been going to school. As a result, in most cases, it is at school where they pass their time. So since schools were closed, they were busy indulging themselves in sexual intercourse and ended up getting the unintended pregnancies. And allow me to give a personal example from the hospital where I am working right now. Before COVID-19, we could see about 4 to 6 abortion cases in a week. But now that number has risen exponentially to around 15 to 20 at times within a week. And that is happening within the period when COVID-19 restrictions were imposed on the country. So that's what I can share from Malawi at the moment.
Thank you very much, Elias. I'm just going to ask you to clarify on the statistics that you gave us. So you said 40,000.
40,000.
Is that child marriages or
no, teenage pregnancies?
Teenage pregnancies, and
teenage
then the 13,000
child marriages.
13,000 child marriages. Okay, thank you for
Yes.
that clarification. So allow me to now go back to Kenya to Messi. So Messi, one of our concerns is that we don't seem to be doing a lot to document all this. A lot of what we have is anecdotal. We hear that child marriages have increased in Malawi. We hear that in Botswana there's increased cases of gender-based violence. Are we documenting this? So as you respond, can you also talk to the research and whether we are doing enough to really track this impact?
Okay, thank you, Patricia, and happy to be here today. We are not documenting enough, unfortunately. And, if I can give an example of Kenya, when the first statistics of child pregnancies were released, and I think the lowest county out of the 47 counties, the lowest county had about 4,000 cases. There was a lot of hue and cry, and that data was actually disowned. And we don't talk about it because it has not been agreed upon. So we are not documenting enough, but I think also because it's a very sensitive area and it exposes our weaknesses in the protective systems, I don't think we want to acknowledge even what is being done by NGOs and some other private, non-governmental organizations about, the statistics. We also don't have evidence of the real evidence of suffering. If I go to the village, and Kakenya will tell you, wherever she works, she'll tell you that we are hearing very sad stories of girls. But these girls, unless somebody highlights them to the media, they don't get known. And yet we have very, very good infrastructures, especially in most countries, including Kenya. Our protective structures go all the way to the grassroots level, but we are not getting the statistics. We are not doing enough research. We cannot sit down and tell you this is how bad the situation is in Kenya. UNESCO did a research, and they're estimating that we are looking at more than 11 million girls getting pregnant in the next 5 years because of this situation and other situations that we haven't been addressing. But we don't have countries Sorry, I muted myself accidentally.
Okay, sorry, I had
Yeah.
lost sound. Yeah.
Yeah, so we are not doing enough research and we are not documenting enough so that we can be able to use that data to make decisions. And even where organizations, individual organizations have gone ahead and done studies, they are not coordinated by the government. So Plan International will do their study here, Save the Children will do their study here, Kakenya will do her study there, but there's no one who is coming to collect all that information and put it in a central database where somebody can now come and mine that data and say, this is how bad the situation is. So I think we need to coordinate our efforts, and those of us who are on the ground need to document those stories and need to really get the voices of the girls and their parents and their teachers and their communities about exactly what is happening. And then we bring that into a central point where we can say, this is how bad the situation is in Africa, and we need to make some drastic measures to address the issue. Thank you.
Thank you. Thank you very much, Messi. So I'm going to pick on 2 points that you've raised there in terms of how can we amplify the voices of the young people, the parents, their teachers from the communities where they are, so that we can actually know what's happening. And another point is on, how do we bridge the gap between research and how do we make sure that the research is informing policy making within our governments? So I'm going to let this lead us into our next question, where I'm going to ask Kakenya first and then Elias to talk to us about, what are the voices of young people saying? What are the concerns from young people on the ground? What do they hope to see or hear from the adults? I'm going to ask the panelists to be brief in their responses so that we can stick to the allocated time.
The young people are worried. Because as Mercy has shared, is that there are systems in Kenya that everything is very decentralized and it's right in the communities. But when COVID comes, we are isolated. We're not supposed, we had curfews, you're not supposed to be out of your homes. They're isolated and they're left out. And they're worried about, not necessarily about going back to school, they're worried about feeding their siblings. They're worried about, they're seeing what's going on in their homes. They are seeing their mothers being abused, themselves are being abused. And I'm talking about a 16-year-old girl. And in my village, that's a big girl. We are told now it's time for you to get out, get married, leave this home, go fetch for yourself. And the situations are there. And the thing is, like, we are thankful because there are so many organizations that are on the ground, like us, we are at the forefront, who are there to listen to the girls, who are there to provide necessities. And I'm talking about girls are going out because they don't have money for lotions. That's how people are trying to exchange sex for basic needs. And we really hope that schools are opened, because we need to go there. The girls need to go back to the schools. They need to be empowered. Yes, we educated the girls, but now they are not even have time to study. They are forgotten things. They were telling me the other day, we are forgetting English because they don't have books at home, and they don't have time to read. They don't have time to take care of themselves. They're just there and they're really left out. And I think that is the biggest thing, is the girls are looking out for us to step up, to reach out to them, to create safety nets. I think it is imperative, even when we can bring girls together, even if it's 20 girls, we bring them together, because that's where they thrive. They don't thrive in isolations. And I would say that they're waiting for us to step up for them.
Thank you very much, Kakenya. I'll go to Elias. And before I do that, I'm going to encourage the participants to use the chat function to put your questions, comments in there so that we can have a conversation with the panelists. Over to you, Elias.
All right, so thank you very much. As for the case of Malawi, young people are indeed worried because, one, access to health services has reduced right now. In particular, I'm talking about youth-friendly health services. This has been so because the focus has been shifted from provision of such essential services to young people to COVID-19. Secondly, schools have been closed. Of course, right now, schools are opening up by and by in Malawi, but then young people are worried that it will take longer for them to graduate from school. And then thirdly, most of them, even though schools are opening up, they can't afford online learning materials that are available online. just because they come from poor families, they don't have the necessary gadgets. For the fourth point is most companies in Malawi right now, they are laying off their workers just because they have also been hit financially by COVID-19 pandemic. As a result, the unemployment rate has increased, and then the young people are worried that even if they graduate from school, where will they, I mean, they won't be getting jobs. Yeah, they won't be employed. So what they are expecting right now is for the government and the stakeholders to reduce the cost of data so that they can be affording online education materials. Secondly, most young people right now, they feel like their parents should be accommodative enough by allowing them to access youth-friendly health services. I know in our culture in Malawi, it is somewhat a taboo for a young person to be accessing such services, but they are willing to see that happening from their parents. So thank you.
Yes, thank you very much, Elias and Kakenya, for outlining, the anxieties that young people are facing across the region. I think we saw Kenya early on saying, the academic year 2020 has been suspended. I think that eased anxieties somewhat, and maybe we can hear from Mercy about that. But for a lot of countries, we had now a system with disparities where those from, what we would call private schools, from where I come from, were able to continue with their education because their parents have resources, they're able to continue with the online learning. But this is a small proportion of the population. The bulk of the learners were not able to access online education because of the issues that Elias is talking about in terms of cheaper, the data is expensive for them to be able to access online learning. So I want to move on now to talk about what resources have we made available for young people in our different countries, so that they are able to continue with their education during this time. So I'm going to ask Mercy and Jane, if you can come in. I can start with Mercy. So we can talk to resources to enable young people to continue with their education, but also resources for young people who we say maybe being pressured into marriage because of the situation that they find themselves in. So Mercy, over to you. And you can also speak to the whole suspension of the school year in Kenya.
Yeah, thank you, Patricia. That is one of the biggest losses for girls. The fact that they have just lost 1 year, and you can see even in social media, you can, like if you're on a platform with some of the young people, you will hear them saying that I'm not growing older this year because I have lost the whole year. For a young person, being in school and being able to proceed to the next grade is so important. You see, their ambition is like, when I'm 23, I will have graduated. When I'm 25, I will have a job. And now they're looking at a situation where 1 whole year is wasted. In fact, there was a sad case of one young man in Kenya. Although he had other emotional issues, when the school was suspended and he was in his last year of high school, he committed suicide. That is how desperate they can become, because it's like, you've ruined my whole life. So that is one of the effects of COVID, actually. As for the resources that were made available for children, I like what you have said. They were made available, but I don't think even 50% of the Kenyan children were able to access. There were TV stations, the TV stations were running classes, the radio stations were running classes as well. Then the official body that prepares curriculum for Kenyan schools had a lot of learning materials that could go online. But unfortunately, if I can give an example of Plan International and the communities that we work with, we have some 52,000 children that we support. And we tried getting the online materials to them so that they can access them. So there are those that you could carry in a hard disk and somebody can download. But the reason why they are beneficiaries of Plan International is because they are very vulnerable. And that means that they don't have phones, they don't have radios, they don't have TVs, and therefore you don't expect them to have computers where we can take the materials and we download the materials on their computers and they're able to access education. So the voices of the girls and the young people are out there is that we have lost a whole year. The girls are saying, I really want to go back to school because I can access pads. And because I also need to talk to my friends, but more it's because I want to report that I am suffering at home. And school provided the safe haven that was now disrupted. So you can see the double tragedy for the very vulnerable that we are trying to reach, and the ones who, who depend on, the resources that are put across by the government, and also, like the NGOs to support them. So even if the online classes were there, and I actually say the Kenyan government did a lot because the resources were there, but they did not reach everybody.
They did not reach everyone.
While in Nairobi and the other big towns, online classes were going on. The private universities were going on with their classes, while the children who really need to be reached so that we can get them equal were even more disadvantaged during the pandemic. If it is the information on menstrual health management, sexual and reproductive health, you also realize that information, most of the time, it will be given by teachers. Parents are so shy. Africans, we don't talk about sexuality, and therefore you realize that we don't even like addressing those issues. So it's girls who get pregnant, and Kenya sex for pads is a real problem. I think Kenya has already mentioned that. The motorcycle riders, the operators in the public sector, transport sector, they are notorious for giving girls, free rides to school, to the market, to church, to wherever, in exchange for sexual favors. And eventually you realize that the girls get pregnant, and there we are. So the resources that are available, they're there. The hospitals are there. And you realize that during the COVID pandemic, we all turned our efforts and our resources, and we went to fight this pandemic. And we did not realize that menses don't stop just because there's a pandemic. And therefore the girls could not access the pads, and they could not be able, so now it became a situation that is a problem above a problem. In schools, the Kenyan government is very good. They provide pads. They are not enough, yes, but they try and provide the pads. Now the schools are closed.
Thank you very much, Messi, and sorry to cut you short. I'm going to move now to Botswana to hear very briefly, Jane, on what are some of the resources that the government of Botswana has made available to get adolescent girls or young people in general, for them to be able to continue with their education. If you can be brief, Jane. And then after this, I'll ask the technical team to get the next scene from the radio drama ready after Jane has responded. Jane, go ahead.
Thank you, Patricia. Yeah, thank you, Patricia. The government of Botswana, when it comes to the resources, we've really tried because as a country, we have the policy or the legal frameworks that really binds us. We have the school health policy, and the school health policy advocates for both boys and girls. But in the issue of the provision of pads at school level, girls are being cared for, by different companies. We do have private sector coming into us.
But more specifically, Jane, I want to pick on the fact that we found that even though the government had online programs running through radio to allow young people to continue with their education, did these reach everyone, or they only managed to reach the few Botswana who are in the more urban areas?
Can you repeat that again? Sorry for this.
Okay, sorry, Jane. So I was just wanting to ask the question of access that we've seen has been challenging in the other countries. So were those young people in the rural areas able to access the online programs being offered by government?
Oh, okay. No, they were not able, not all of them were able to access the online. However, schools arranged in the rural areas to, we had a COVID response team for the regional response team, where they all get together in their respective villages to try and address all the issues affecting learners at school.
Okay. All right. Thank you, Jane. I'm going to ask the technical team now to play us a scene from the radio drama. Panelists, please, we will come back to you for the next segment of the conversation. So stay tuned.
Say it loud.
Good evening, Fatima.
Mr. Bravis, what are you doing here?
He was the one that called this morning. So you know him?
I only met him once. I don't even...
Just sit down, Fatih. We need to talk. Bravis came to look for your father and me. I know you are becoming a woman, and Bravis has come to ask for your hand in marriage, Fatima.
What?
My dear, you have been in my heart since that day we met. My heart is full of you.
Please stop. I'm not interested.
You say?
Fatima, I just think about it. If this man is your chosen from God, at least...
Chosen? Is this what you want?
I want what is good for you. But you are young and you don't have experience in...
I'm young, yes. But I know what I want. And I don't want to marry now.
Madam, I think your daughter is not understanding what I'm saying. Maybe if...
Bravis, look, I think you are a good man. But if Fatima does not want this, then...
But I am ready to do anything. Anything.
Our peace of mind is worth more than anything anybody can do for us. Fatima's father taught us this. He was a good man.
And
You have heard Fatima. She said no.
Please take your things and leave.
Say It Loud is made in Africa by Flint Productions for UNESCO, UNFPA, SAFES, and Save the Children Sweden in partnership with PCI Media.
Yes, thank you to the technical team. So what we played is a scene from the radio drama that's been produced for the Let's Talk campaign. The radio drama is called Say It Loud, and it addresses many of the challenges faced by young people regarding sexual health, gender-based violence, and early and unintended pregnancy, particularly now in the context of COVID-19. So really, I think an interesting scene there. I almost wanted to clap my hands for the mother for standing up. I think it underlies the important role of advocacy and awareness raising with parents so that they can play a more active role. So I'm going to go back to my panelists and just find out from you what were your main takeaways from the scene that we've just had in the context of these issues that we are discussing today. For the participants, we still welcome your questions. Please keep them rolling. With the next section, we'll move to the question and answer. So I'm going to start with, who can I start with? Elias now. What are your main takeaways on this short skit on early marriage?
Okay, so I've just realized that there are some parents out there who are contributing to this thing. I mean, we've heard that in the play that a woman who was or is a mother to a child, I mean, allowed a man to come to the house and then to discuss the issue of marrying the daughter. I mean, this is absurd, and it's really happening in Africa. And I mean, this is something that we need to do something about, and we must stop it and protect our children.
Thank you, Elias. I think also as we speak, let's think about some contexts where it's really in a poverty situation where sometimes mothers are forced to make decisions that they wouldn't want to make, but because of the poverty brought on by the circumstances exacerbated by COVID-19, sometimes we find ourselves as mothers making decisions that are, that we wouldn't want to normally make. I'll go to Kakenya. I see you nodding there. I think you recognize the situation that I'm talking about. Please go ahead.
What I liked about the episode actually was like, I want every mother to be able to speak up and speak up for their daughters, to say you've had her. And this is what really we want to do, is being able to empower the mothers to speak up for their daughters and to say no. And I know there are situations like in most of the African continents, I don't know about that, but in Kenya, where we have dowry, and in my community, the Maasais, when a girl is married, the family gets 9 cows. Trust me, that is huge. That's a huge incentive. So you become wealthy because of the cows, and that actually, so that can be, and I think that will actually, that's what I was noting, is there are situations that parents would feel like they needed to give away. And in the context of early teen pregnancy, when a girl gets pregnant, you know what happens. The mother is going to force her to go to the husband, to the guy, to the person, whoever, because there's shame in that, and they don't want that shame to come. And then the mother is normally being blamed. And there are a lot of juggling of emotional that is going on in their homes. And I think that there's so much that we can look at. And it's not just easy to just say one thing is the right and the other. But I really hope that we can empower mothers, we can empower girls to speak up for themselves and to speak up for their daughters.
Yeah. Can I hear from Messi?
I think for me, it's just the fact that our society has treated child marriage as normal, and nobody sees a big deal when a 12-year-old is being told, you know, you have to get married to a 40-year-old, to a 50-year-old. You know, that in itself means that we are not angry enough that our children are losing their childhood. And it worries me that we also probably do not conceptualize how much trouble we shall be in 20 years from now when we need leadership and we never took our children to school. So looking far ahead, you know, right now it's COVID, we don't have money, I can get 9 cows. For us in my community, it is goats and it's supposed to be 100. So really it's a high price to pay, and the family can move on for a few months. But what about the future? Yeah. Even if we want to talk about the affirmative action and gender equality, for as long as our girls are not going to school, we will not get them to the leadership positions where we are in. So listening to that clip, it's really sad that you know, it's a casual discussion. There's someone who wants to marry you, kudos to the mother, and I hope more mothers can wake up and say, you know what, you have had her, she doesn't want it, she wants to be in school. Next time that girl gets married at the age of 20, 25, they will not marry off their daughters. And that is the only way we can change the story of and stop the perpetuation of gender-based violence. I would call it gender-based violence and disempowering women. So that is what I you know, is stuck into my mind.
Thank you very much, Messi. They really confirming that child marriage perpetuates the cycle of poverty, because that mother is going to have children who are going to be in that poverty, and it continues, and reminding us that we need future leaders. If we marry them off at 12, what happens? Jane, I'll end with you on this question, and then we can move to what actions parents can take to minimize the effects. Jane, can you unmute? Hi, hello, Jane. Can you unmute?
Oh,
great. Thank you.
What action parents can do to address the issue? I think we need to really strengthen or to intensify our consultations with parents and educate parents more on these issues, because especially on sexuality issues, because from time immemorial we've been, the communities have been thinking that you can boost your status, your family status, or through introducing your children and your child to such activities where you find a rich, a wealthy person come into your family and actually, go through and get married to your young girls, or you expose your children to to elderly people because of your low because of the socioeconomic status. And again, you know, I guess it to also strengthen our life skills training within in the schools or within the communities, so that the issues of parent-child communication is intensified, and they will be able to discuss these issues with their parents, how they feel about anything that is not in sync with how they feel them as learners or as children.
As children, yeah. Thank you very much for that, Jane. I'm going to ask any of the panelists if anyone wants to respond on this point. What are some of the actions that parents can take to minimize the impact of COVID-19 on their children?
Yes, I have some points to add. Firstly, I would like to agree with what Jane has just said. I think it is necessary to equip parents with comprehensive sexuality education, so that they should also be able to pass that very same information to their children. By doing that, would be preventing our young girls from having sex at an early age, and then getting these unintended pregnancies that we are seeing on the rise in most of the countries in East and Southern Africa region. Adding to that, from a youth perspective, I would also like to appeal to parents for them to open up and allow their children to be accessing youth-friendly health services. I mean, let's face the fact, the numbers are out there that young people are having sex and they are being impregnated. And then if we deny them the right to access sexual and reproductive health services, it means this issue won't be resolved anytime soon. And then parents should just allow their children to access such services. And thirdly, which is also my last point, parents at this point in time, they should keep their children, especially the young girls, they should keep them busy at home with studies or household chores and other stuff that will prevent them from indulging in unnecessary sexual behavior with their boyfriends or man friends that they have. Thank you.
Thank you. I want to now turn to Kakenya, who's the founder and president of Kakenya's Dream. I want to prod a little bit, Kakenya, and ask you to share with us your personal story and how we came about to have this organization called Kakenya's Dream, because I think it's really inspirational. When I read your bio, I was really inspired. I would like the audience to have an opportunity to listen to you briefly talk about, how Kakenya's Dream came about.
Thank you so much, Patricia. I was actually engaged when I was 5 years old. I grew up in a small village in rural Kenya, Maasai. I'm the first of 8. And in our communities, as we talk about child marriage, girls are getting married when they're 12. It's a reality. It's a everyday thing. But I was able to go to school, and I had the space to be able to learn. I had a very strong mother who supported me, and that's why I was really nodding for the lady who was supporting her daughter. Being able to go to school enabled me to get a scholarship. I ended up in university. But what really found is that I learned about human rights. I learned about FGM, that it's against the law in Kenya. I learned about child marriage. I learned about all these things when I was actually in university. And that's why I went back to my village to really provide information. As Mercy was talking about, being able to be in the communities, being able to be in schools, to be able to provide young people with critical information. These were not information that are available in schools that I went to. And so Kakenya's Dream is really about changing the stories for young girls to escape early marriages, to escape female genital cutting, which is another story we can talk about, gender-based violence, and to give them a space to be able to thrive and achieve their goals. And so we have over 500 girls that have avoided FGM, that have avoided early marriages, that are thriving and going to school. And we are trying all we can as we face COVID to really provide for them. So when we talked about this, there's no access. So we had to provide them with solar radios, we had to provide them with solar lights, we had to print materials for them because they don't have cell phones and they don't have computers, we don't have internet in the villages, and really being able to be right there and being present for the girls. The thing that we haven't talked about is the psychological isolations and trauma that the young girls are facing. And not being able to, as much as we say LS, I mean, Kenya, we have illegal abortion. Abortion is legal, so a girl can just walk into a clinic and get abortion. So they are doing these quack things, and like we're losing lives. And it is, Mercy was saying, this is the next generation of women. When we look up for the future, where are our leaders going to come from? And it's high time that we, as much as we want to provide the parents information to be able to change their mind shift, it takes time and it takes persistence. And I want to encourage everybody who can go out, being able to support a girl to be able to live a different life. That is the future that we want for, and that's what Kakenya's Dream is all about. So thank you.
Thank you very much, Kakenya, and for reminding us of the importance of mental health. I think in a lot of our countries, mental health is something that we overlook, and particularly for young people. We saw that during the period of school closures, a lot of young people were worried. But as parents, as professionals, as government, we really didn't take the time to listen to and try and respond to some of the anxieties that some young people were facing. We had someone talking about suicide, really just wanting someone to listen to and reassure you that actually it's not the end of the world, that schools are closed, you're going to be able to continue with your education. It's important, and that's something that we really need to look at and address psychosocial support issues for young people. So we've run out of time, and I still have one question here. I'm going to direct it to Mercy. If you can speak to us, Mercy, before we go into the next segment where we open up for the conversation to our participants. How can communities, educators, and leaders support our young people to continue their education, delay pregnancy, despite these school closures and other complications that we are facing today? Thank you, Mercy. Please go on.
Oh, sorry. Thank you. I think for me, what I would say is that first and foremost, we need to get the information out there. And it is very important that the information is available, it is accessible, and it is appropriate at different ages. I know in Kenya, what we are fighting is the whole issue of the comprehensive sexuality education. The traditional and religious leaders that don't want that kind of information to go to the schools. And I think for me, what I can say is that the stakeholders, who are the parents, the politicians, the religious leaders, the traditional leaders, they all need to come together and realize it's not about them. I think that's the first thing. Let's realize it's not about us. It's about our girls and our future as a country. So once we are agreed on that, then we'll get on the table and negotiate. What is it that the religious leaders don't want? Can the politicians be able to accommodate that? Can the traditional leaders be able to accommodate that? So that information is available and it is accessible and it is appropriate and it is responsive according to the age. I think that is the first thing. The other thing is that when we get the girls, unfortunately, if the unfortunate thing happens and they are pregnant, we need to support them to continue with school at some point. In a conversation that was there last week, one of the religious leaders said that if a girl gets pregnant at the age of 15, then they should be married off. That is not a solution and that is not an option, and we shouldn't be hearing that. So the return to school policies for the countries, I know Kenya has one and a few other African countries also have one. They need to be made available. There needs to be also reporting mechanisms and protective mechanisms so that most of these cases of pregnancies are out of violence because you're locked up together with a perpetrator. Your parents go to work, and in your neighborhood is a perpetrator. And girls need to know how to call, who to call and to talk to when there is a problem. Most African countries have the Child Helpline 116. Unfortunately, most of the helplines are underfunded and they struggle to keep up with the load of calls that come. So the government needs to invest in that. Let us invest in child-friendly, youth-friendly, and adolescent-friendly sexual and reproductive health services. So that if these people cannot be able to talk to their parents, they cannot be able to talk to their teachers, it is important that there is a medical facility somewhere that is equipped now with somebody who can be able to take them through counseling. As a community, as a society, as a country, we need to invest in prevention. We need to invest in reporting and responding, and we also need to invest in the services. The gender violence recovery centers need to be operational and they need to be accessible. Our police need to be trained so that when these girls go to report, then they find a friendly service and they don't have to shy away. And parents need to just sit with their children and talk about sexuality. It is beautiful, it is not a taboo, and Africans need just to wake up to that so that the girls can be able to talk and the young men also start respecting. In this fight against teenage pregnancies, it would be unfortunate if we think it's about girls and women. It's about the men and the boys too. Let us involve them. Yeah, I think that's what I can say.
Thank you very much, Mary. Messi, sorry, and I think in this context where we are seeing a lot of opposition to comprehensive sexuality education, some of you have made reference to comprehensive sexuality education. One of the key takeaways for me from this session and other sessions we've had in the past is there's no argument about the issues. We all agree that we have high early and unintended pregnancy, we have child marriage, and so on. So perhaps what we need is to turn the conversation so that the conversation is not about sexuality education, but it's about addressing these challenges that young people are facing. Because I think the challenge with sexuality education, comprehensive sexuality education, it's the terminology that is understood differently by different people. So if you're talking, I found that, in rural Ethiopia, wherever it's in Malawi, when you're talking to religious leaders and talking to communities, there's no argument about the issues facing young people. So maybe that should be our starting point of the conversation. And then comprehensive sexuality education and access to services comes in as one of the ways that we can address these challenges that young people are facing. Thank you very much to my panelists for this, this segment. We are now moving to the question and answer, and we'll get an opportunity to respond to some of the questions that have been put in the chat. So I'm going to ask Janice, my colleague, maybe you can go through 3 questions and then I will direct the questions to the panelists like that. So we do the first 3, we get responses, we go back to the next set of questions. Thank you, Janice.
Thank you, Patricia, and thank you to all the panelists. Let me start with the first question that we have from Lebogang Motibaletse. The issue with EUP is not perpetratorless, and there is too much focus on the impregnated girl without emphasis on the person or people who impregnated them. Many of the countries are reporting an increase in child, pre- and teenage girls who were impregnated. Are any of them also seeing an increase in arrests or charges made against those who have impregnated or violated them? That's the first question. I'm going to move on to the second question from Masimba Nyamcheta from Zimbabwe. Good afternoon. Has there been any systematic efforts by governments to track all learners during the COVID pandemic to give an accurate picture on those affected by pregnancy, marriage, and other related factors? The third question comes from Atem de Cook. There's an alarming amount of data coming in from all of the countries. What concrete steps must parents and partners take to protect adolescents and help them achieve their dreams? Over to you, Patricia.
Thank you very much for those questions, colleagues. In fact, the question from Lebo reminds me of what Reverend Mabizela always says, one of our religious leaders from South Africa. She says that actually there are some men who are pregnant in this room. It's just that the evidence is not shown. So we focus very much and we blame the girl who is pregnant. And as we do that, even some of those men who are pregnant are part of those who are blaming the girl. So the question is really around perpetrators. Have we seen an increase in charges also bringing perpetrators to book? I think it's been difficult to find out who is actually making the girls fall pregnant. Is it men in the society? Is it boys that of their age that they're going to school with? I'm going to ask Kakenya to respond to that question. And then I will ask Jane to respond the question on, are we tracking learners so that we can get an accurate picture? So we know a number of learners are falling pregnant, some are getting married, but do we have a system of tracking learners? I know that our education systems are very good at tracking learners when they're coming to school, because we call out the registers, we enter the MIS, and we have the annual school census. But now in this situation where learners are not going to school, do we have a mechanism of tracking? And then the question on concrete steps, maybe I'll ask Mercy to respond to that. Yeah, so I can start with you, Kakenya.
I think we've talked about a lot today about isolations and how girls don't really have access to these friendly services and friendly places to go to. I can tell in Kenya, I have not seen any increase in terms of bringing the perpetrator into to be responsible for what's happening. Again, it's because one, we are blaming the girl. She's been very available. Maybe the girl had exchanged this for sex. She's feeling guilty. She can't come and really report this. And this is where the school was really very important, because before the girl, when she's in isolation, she doesn't have anybody to talk to. There's no teacher to go to and tell what is happening. There's no youth-friendly services that are available, not even in the clinics where she will go and be able to tell. So I think no one is reporting anything. Everybody is quiet. And I think it's like, this is where really the social nets that are needed, that needs to be up there. And I think there's a whole system that needs to be, I think we've had like the chiefs and the people saying, we need to report this, we need to report this, there's words, but we have not seen this bring justice to what is happening to the girls. Yeah.
Thank you, Kakenya. I'll now go to Jane to speak to whether they have a mechanism to track learners during this time.
Oh, yes. Hello. Yes.
Please go ahead. Yes.
Yes. Yes, there are some efforts to try and track these learners. Now, I mean, in schools, we do have the EMIS. We are trying hard to bring things together to try and track every child who drops out of school. And because of our policies, the retention policy, I think it's high time we work on the retention policy and strengthen it, so that we don't leave it open as it is, whereby, you know, it is left to the, you know, to entirely to the schools to decide whether, you know, kids are coming back or not. And then, of course, or in Botswana, with the you know, with the CSE, strengthening SE, we are trying hard dialogues to try and empower the parents, so that the communities, so that on issues of sexuality, so that they get to know, they really get to know. And our system in this country is such that any child that is pregnant has to be registered at the clinics. So all these that are registered through the district management teams, they are subdivided into, you know, age ranges. So through the parent-child communication workshops, we were able to work together with Ministry of Health, whereby they will provide statistics within communities, and then people were able to know who exactly is or what is happening within the community. And in that way, yeah, why I'm saying it's better, maybe the retention policy would do better for us. Can come up with a clearly stated, you know, policy or guidelines where we will empower everyone, the community, the parents, the school, and even the learner themselves.
The learner.
But
Thank you. Yes, thank you very much, Jane. I want to ask Elias as well to speak to that issue of tracking learners, because I know that as a health worker, you are also seeing some of these learners who are falling pregnant. From the health side, do you have a way of tracking these learners, especially during this time when schools have been closed?
To be honest with you, I can't comment on that because I don't know if there is any system, or if it's there, I don't know if it's a working system. So I'll have to find out first. So my answer is I don't know if that is being done.
No, thank you, Elias. I think this is a new challenge that most countries are facing in terms of tracking learners. But I think if we remember that schools operate within communities, I think there's a lot that can be done to use our community-based systems to see and be able to follow up on those learners who are, as schools start opening, won't be able to return to school. So I think that's something food for thought for the panelists, and also particularly those from government who are on the panel. I'm going to ask Messi to respond to the last question while I ask Janice to be ready with the next set of comments and questions.
Okay, thank you. The last question was on the measures that the governments are taking. I hope I got that right, Patricia.
Mm-hmm.
Okay. Some of the things that are happening in the communities, I know that the access to prenatal care in Kenya has been opened up, and the government facilities are really trying to encourage young mothers not to give birth at home because of the complications and because of the effort to reduce maternal mortality, child and maternal mortality at birth. So there is a lot of encouragement, and that is how we are even getting the statistics of how many times adolescents have visited clinics for antenatal care. So I think that is one of the things that we can say. There is a flip side to that the Ministry of Health is not giving enough information to the Department of Children's Services so that they can be able to follow up on the perpetrators. So the Ministry of Health is succeeding in getting the young mothers, the teenage mothers, not to give birth at home. But when now, if I go back to the question of perpetrators, we have no way of getting the perpetrators because that collaboration within the government is not there. The other thing that has happened is that organizations and even governments are really raising awareness during this time through the media, through social media, the alternative medias, the mainstream medias. There's a lot of sensitizations about teenage pregnancies and how to keep themselves safe and how girls need to be protected. So that information is there. There are helplines in Kenya. We have 116, which is, I think, all over Africa, the child helpline, but we also have another one toll-free as well, 1195, where you can call for gender-based violence. We are now also seeing that the police stations have child protection desk and gender desk. So when you go to report, in most police stations now, you find a friendly person who has been trained and they can be able to record your statement. A lot of sensitization on parents so that they don't marry off their children and so that they are supportive of children who are getting pregnant. There is no formal way of getting to parents other than through the media, through the the religious houses, the mosques and all that. Yeah, but I think the efforts are there. And of course, INGOs have come out very strongly, the UN agencies have come out very strongly running joint campaigns like the one that is happening in Kenya, UNESCO, Plan International and UN Women, just to raise awareness of what people need to do when girls get pregnant. It doesn't mean a death sentence to them. We need to instill hope and we need to give them an opportunity to recover and continue with school. So a lot is happening, but again, we are not reaching the most vulnerable who cannot access the nation. The media, they are not on social media, they cannot have the phones, they don't have radios, they don't have TVs. So now we need to use the community mechanisms so that this information can reach even the most remote areas where the most vulnerable girls are found.
Thank you for that reminder. I think indeed, as we run campaigns, as we run programs, we need to think about where are the most vulnerable. When UNESCO did research on early and unintended pregnancy, we found that who is falling pregnant is the poor, rural, uneducated girl. So if we have our campaigns in urban cities, urban centers, we are missing out on our target group, who is that girl who is poor, rural, and uneducated. I'm going to ask Janice to come back with questions, comments, and then again, we'll do the same way, ask the participants, the panelists to respond.
Thank you, Patricia. I'm going to start off with a couple of the comments that we have here. Kensington Marufu from Zimbabwe Shamva district. COVID-19 has led to a closure of schools in Zimbabwe. It has been noted that in this community I come from, with or without COVID-19, school is not valued by individuals because there are very few role models in the district. The coming of COVID-19 has led to an accelerated rate of school dropout. Most of school dropouts have resorted to illegal gold mining. That's our comment from Kensington. We will move on to another comment that we have from Leah Adiambo. The Kenya scenario. Most girls acquire SRH information in schools. That is where people like me who are disseminating the information to girls in schools meet. All of the restrictions of social platforms due to the pandemic has made it hard for us to reach many girls. This is from Leah, from the Adolescent Girls Friend organization. Yeah. I think I will go back to the questions for now. We have one question from Samantha Chidodo from Zimbabwe. In Botswana, how did the issue of GBV in this COVID era get solved or dealt with so as to promote peace in the communities?
Can we have more questions, Janice?
Yes, I'm going to the next question. Another question from Tuyemo Haidula from Namibia. Despite escalating teenage pregnancies and child marriages in Namibia, the country has decided not to offer comprehensive sexuality education in schools next year. Namibia, as a country which is predominantly Christian and has churches which stand by the decision that was made, I strongly believe this will not be beneficial to the girl child. Students and youth leaders say that they have not been consulted with the decision on CSE because it is making a difference to young people's lives. However, being Namibian and knowing how much influence political leaders have, this is a done deal. How can we as journalists stop this from happening, if at all? My third question is from Kensington Marufu. It goes to Mercy Chenge. Speaking on the issues of re-entry of children who have been married in school, how can we fight the established societal practices that discourage these children on re-entry to school? Over to you, Patricia.
Come again on the last question.
The last question to Mercy Chenge, speaking on the issues of re-entry of children who have been married to school, how can we fight the established societal practices that discourage these children on re-entry?
Okay, so thank you, Janice. We're going to start by asking Jane to respond to the first question on how has Botswana addressed the issue of gender-based violence during this COVID. I'm going to ask respondents to be very brief in their responses. We only have 4 minutes before we wrap up the session, and I still want Janice to go through some of the comments.
Thank you. In Botswana, ever since COVID, the GBV escalation, the Ministry of Local Government through the child protection committees within the regions have really tried to strengthen and tighten, and they actually through their committees they've gone to to the grassroots level where they then access homes to try and address these issues. And through, of course, we have NGOs that are working closely with families to try and really empower and assist where necessary. And then we have the guidance and counseling program, especially at school level, where we have tried to strengthen and tighten our screws to try and address these issues at school level. And then our referral system, we are currently working on our referral system because this has really shocked us as a nation. And our referral system is such that we've come together to make sure that anytime when you encounter with a learner or a child who is being abused, you take them through, and every stop, I mean, every station where you refer to, I mean, you should have a close-knit, link, and make sure that you don't lose out on information, or you really assist this learner. Even the religious leaders are now working together closely with the communities to make sure that these issues are addressed. Thank you.
Yes, thank you very much, Jane, for speaking to us on what's happening around responding to gender-based violence in Botswana. I'm going to take the question on the issue of Namibia and the increasing opposition to CSE, leading to discussions around whether Namibia should continue offering CSE. It's really a pity to see this, because Namibia is one of the countries that has done very well in terms of scaling up comprehensive sexuality education. Namibia has, allocated dedicated life skills teachers, who are the teachers who teach CSE in each school. They have been trained well. There's considerable investment that has gone into comprehensive sexuality education in Namibia. We also know that Namibia has very high rates of teenage pregnancy, very high rates of gender-based violence. But like the wave of opposition that we are seeing in the region, which, where it's coming from outside, they engage with, people internally, influence this agenda around comprehensive sexuality education is not good for children, and so on. We've seen this happening. I think we've seen it in Kenya. We've just recently seen it. We've seen it in South Africa. We've seen it in Zambia. What I can say to the participant is, I think the fight is not over. We cannot lose this fight. It's too important. It's about the future of our children. I know that recently in Zambia, when we had the intense opposition to comprehensive sexuality education, many stakeholders, from parents, from religious leaders, from parliamentarians, civil society, came together and said, no, we are not going to pull out comprehensive sexuality education from the curriculum. We can open up and have a dialogue to look at the content that you're saying you're not happy with to have in the curriculum. So let's open the conversation. Let's not throw the baby out with the bathwater. So I think that we are likely to see a similar scenario in Namibia, because of the issues that I've talked about. And someone is just reminding me on the chat, and that's my colleague Maria, that the youth of Namibia also need to make their voices heard. The youth need to speak out and make the case that they do need comprehensive sexuality education. We also want the parents, the religious leaders. I'm happy to see Reverend Jassy also commenting on the chat. So we do have, support. We do have a critical mass of people who really realize and value the importance of addressing the issues that we're talking about, and through various means, including comprehensive sexuality education and access to services for young people. I'm going to take the last question and ask Mary to respond. Colleagues, I'm going to beg your indulgence. We've gone over the time. We're supposed to finish at 15:15. If it's okay, we'll take it to 20:20 so that I can ask Mercy to respond, and then we can take one round of comments before we conclude. I think this has been really an interesting conversation. I really beg your indulgence to take 5 more minutes of your time. Mercy.
Okay. Yeah, thanks, Patricia. I'm going to be very brief. And the question was on what do we do so that we can encourage the full implementation of the school reentry policy. And I think the only thing I can say is that we really need to fight the stigma. The reason why most girls will not go back to school, even if the policy is there, is because they are made laughing stock. They become the laughing stocks. The teachers make examples of them. They look like they are a lot older than their classmates, and they feel out of place. So it is important that the school creates an environment where the girls can come back to school without being embarrassed. There is no stigma, and they continue with school. And if they need to rush home to go and breastfeed the children, that should be provided and it should be normalized so that they're able to go back. Most of these girls have been abused. They didn't go there willingly, and the schools need to be very encouraging. And also the home environment. Parents need to know that once a girl is pregnant, it doesn't mean that that is a certificate to get them married at the age of 12, at the age of 15. The home environment needs to be supportive. And it is important to empower the girls. If the schools cannot provide that space for you, go and demand it. Go and sit in class and excel and graduate like everybody else, and don't mind what they are saying. That will not come very easy, but we need to give them the agency. We need to empower them so that they can be able to fight for their own space. Because most of the countries have the policies. And lastly, the government needs to track 100% transition. That if a girl has been to a certain class and they enrolled, even if it is after 1 year when they get babies, they need to come back and complete school. There is something that was started in Kenya, where everybody who sat for the end of primary exam, they were tracked by the local administration to make sure that they proceed to high school. And I think that needs to be employed as well, so that every girl who drops out of school after 1 year, they should resume school and continue. So I think with those measures, encouragement from all quarters and the policies being implemented, we'll see a lot more girls getting the opportunity to continue with their school. Thank you.
Thank you very much, Mercy. At this point, I know there are a lot of comments and questions in the chat. I'm going to ask Janice to read for us 3 comments, and then I'll go back to the panelists to give us 1 sentence to share your takeaway from this session, and then we conclude. So Janice, over to you. If you can pick up 3 comments, and then we go back to the panelists for 1 sentence each.
Okay, thank you, Patricia. Our first comment is from Yolanda Tini from Rosaria Memorial Trust, Zimbabwe. Parents need to take part in assisting learning institutions to counsel young people so that they abstain from sexual activities and reduce the cases of early and child marriages. Thank you for that. My next comment is from Peter. Due to COVID-19, a lot of parents are struggling to buy basic needs for their families, and with the little money that they have, they cannot buy sanitary pads for girls. There's period poverty due to COVID-19. Although schools have been opened, girls will continue missing classes due to period poverty. We need to work together in improving access to menstrual hygiene products and facilities in secondary and primary schools as one way of keeping girls in schools during the pandemic. I'm going to take the last comment from Lebogang. There should be age-appropriate access to sexual and reproductive health information for primary school, even if it empowers a child to know more about their body, consent, and other people's bodies. Thank you, Patricia. Over to you.
Thank you, Janice. So before I go to the panelists, please indulge me. There's a young person from Namibia who's the president of AFRIAN, and she, I'm not sure if it's she or he, wanted to comment in regards to the youth response to the CSE issue in Namibia. I think this is an important issue, and it's important for us to hear from young people. So Clive at Mwandingi, I'll give you 1 minute for your comment.
Could we ask Clive to write his response in the chat box, and then we'll be able to read it out, because unfortunately we can't allow him to speak.
Okay. So Clive, you'll write it as my panelists are speaking, and then Janice will pick it up. Thank you. I'm going to start with Elias. 1 sentence, with your takeaway from today's conversation.
Okay, I'll be the last one to give my takeaway, but then I wanted to comment, to add something to Mrs. answer. In Malawi, we also have the readmission policy. However, it doesn't have some provisions. For example, I would be happy to see bursary schemes being given to those young women who have gone back to school after giving birth. But then such things are not there in the readmission policy. I don't know if in the other African countries who have the readmission policy do have such provisions. Maybe Malawi could learn from that. Yeah.
From other countries. Thank you, Elias. I'll come back to you for your last points. Mercy, do you want to give me 1 sentence of your takeaway from this conversation?
Yeah, thanks, Patricia. I think for me, what I can say is that it has really been an enriching conversation, and that one that should continue. And thanks so much for the organizers. I think we need to just intensify mentorship and not give up on our girls. Whatever happens to them, we know that we have a responsibility as a society and as leaders to make sure that they overcome the obstacles, even obstacles of teenage pregnancies, and continue. If they fall, we don't leave them where they are. We continue supporting them and take them to the next level. Thank you.
Thank you very much for that, Messi. Can I hear Kakenya? One sentence, please.
It's been a very lovely conversation. Thank you, Patricia, for your guidance through this. My one question, my one response is actually, I know there are many young people who are listening to this conversation. I want to challenge each one of us to go back, and even if you're already mentoring someone, I want us to take it as a take action and say, I commit to mentor someone to make their life better. And that's a young girl in high school, in primary school, in your community. We need to take that as our responsibility.
And that applies to all of us, males and females, right?
Yes.
Thank you, Jane. Your one sentence, please. Can you unmute? Yes. It looks, yeah. Jane, you're on mute.
I think, thank you, Patricia. This has been a very, I have unmuted. I think this has been a very interesting discussion and a wake-up call, especially in the era of COVID. I think it's high time we quickly come up with a retention policy that is evolving and that is well elaborated for the girl, for the school, and the parent. And
okay.
And coaching and mentorship should continue among all these girls. Thank you.
Thank you very much. Last but not least, from Elias, one sentence.
Okay, so the conversation has been informing and educative, and I hope it will continue as stipulated in the program. And in conjunction with the conversation, I hope that this will spark like actions to be taken in most of the countries in East and Southern Africa where the issue of early and unintended pregnancy is on the rise. Thank you.
Thank you very much, colleagues. Thank you to my lovely panelists. We've come to the end of the session. We are still waiting for Clivet to send through the comment, but in any case, if they don't manage to, we can reach out to them because as the president of AFRIAN in Namibia, I think it's important that we continue the conversation with young people so that we can hear their voices clearly. So thank you all for your wonderful contributions. Oh, okay. So I've just seen the comment from Clivet. In response to making sure we keep CSE being implemented in Namibia, we as the youth are working together with some partners from the UN family and youth-serving organizations to mobilize young people as to why CSE is important. Moreover, with the increase of teenage pregnancy during the lockdown period, we are also having a dialogue with the AU envoy who's visiting us in Namibia this week to have a dialogue with members of parliament. That's all I can say for now, but we will reach out to Clivet and continue the conversation. So on behalf of UNESCO and the Let's Talk campaign regional partners, I would really like to thank you all, to the participants, to our panelists for participating in this first session of the Say It Louder webinar series. Please visit the Let's Talk campaign website at letstalkeup.com to learn more about this initiative and ways in which you can get involved. As I've said, this is the first in a series of webinars, so there's an opportunity for you to get involved. If you get in touch with us, you can come on as a panelist if you want to speak and bring in other young people. And remember what we talked about. We want to reach the more disadvantaged young people so that these platforms are not only for those who have access to technology, because by doing that, we keep widening the gap. And what we want is to be inclusive and to close that gap and make sure that young people who really really need this information are getting it. So we've also, with the help of our fantastic technical team, we've been able to record this session, and it will be uploaded on the Young People Today and the Let's Talk campaign website for those who want to revisit the session. To our partners, PCI Media, thank you very much for the support. We really appreciate the smooth running of the session. Thank you so much to the panelists, and thank you for indulging me. We almost finished at past, taking 15 minutes of your time, but the conversation was interesting. I think let's keep talking for the benefit of our young people. Thank you.
Thank you, everyone. So it's lovely. Good job, Patricia.
Thank you.